hips now. So you can leave the mats, we can kick the mats to the side. We're going to try to make a big circle coming all the way around. Give yourself a little bit of space, and I'm going to come to the middle.
Big circle.
So you can keep your shoes on, take them off, whichever one you want. Again, we're going to do another test again. We're going to see how far you can get into a squat, keeping your shoulders back, keeping your chest up, and what's one of the most important things you got to do with your heels? Keep them on the ground. So you should be able to get a little bit lower since we just worked with that dorsiflexion. So once everybody gets shoes on, however you want to get, I want you to squat down and hold it. And again, estimate how far you can get. And when we get finished, we're going to do the squat again. You may not be able to get to it with those. Good. Chest up a little taller there, Marcy. Great job, Darlene. Chest up a little taller there, Karen. Good, Sandy. Good. You're at 90 degrees, 90 degrees. Bars low. Good. Mike's close to 90. Rick's getting pretty low there. Good. Again, you want to make sure your knees don't cave in. However, your toes are pointed. We always want to make sure the knees. So if you go, for me, my squat, I have a little bit longer legs. My femur's a little bit longer, so I slightly point my knees out. That allows my hips to expand when I get into the squat. So estimate about where you're at right now. When we get finished, you may not feel like you're getting any lower, but you may feel like, for me, again, I get that left hip pain. I get that deep pain inside. But after I do the mobility drills, I'm going to show you, I don't feel that sensation as much. So standing exactly where you're at right now, what you're going to do is you're going to stand where you're at. This one's called a knee grab. You're going to flex your knee up as far as you can, hold it for 2 seconds, take your hand, and then do an additional 2-second pull. So that's going to help you get past that range of motion you can get on your own. You're going to bring that leg back down. So again, hold it 2 seconds, grab it, and then pull for 2 seconds. So it's going to be actively holding it 2, then you can passively pull it up and get deeper into that range of motion. You may feel a deep little pain in the hip. I feel it on my left one right now. I'm not fully warm, but again, just gradually let it pull up, and then you're going to lower it down. Again, as you're doing a squat, the flexion, the knee angle is going to decrease to the chest. Again, hold it, try to pull it up. Good. We're going to do it for another 30 seconds on each side there. Keep going. Again, pull it up. Try to pull it a little bit higher than Helga. Balance and then pull. So go into the work with your balance as well. Good. And then switch it, Jesse. Grab a hold of it. Pull. Good. And you should be able to feel you're able to flex it up on your own further and further each time. We'll go another 15 seconds on this one. Pull, pull, pull. Good, Karen. Get a little bit higher. Great job, Darlene. Good, Tammy. Switch to the left side. We'll do the left one more time and the right one more time. Good. Now drive it up there, Rick. Good, Rick. One more. That's not bothering me. All right. Yep. One more time on it. All right, so that one's the knee grab. Pretty simple. You can do it. So say you just warmed up in the back and you did high knees. You did fast squats. You did some lunges. Your heart rate's up. Now what's going to happen, again, the temperature of the hips is going to be increased. It'll allow that tissue to expand more. So then you can go straight into that knee grab. All right, the other one. This one is what I like to call going over the hurdles and under the hurdles. The first one we're going to do, we're going to imagine this is a hurdle that people use in high school, college, jumping over. So we're going to imagine that's a hurdle. What you're going to do is you're going to get a wide squat position. So I want everybody to get into a wide squat position. What you're going to do is you're going to go to the right side and squat down. This leg's going to be fully extended. And you're going to imagine that your head is going under the hurdle. So you're going to come under the hurdle, stand at range of motion, and stand all the way back up. And then you're going to come back over. Again, how should the heel be on the ground? Land to the ground. So if your heel's coming off the ground, scoot your leg a little bit further back. That'll allow you to come all the way back. Again, try to get your head all the way up under. We're going to go back and forth to each side for a minute. So you're going to go down, hold it, come up. So it's take you about 3 to 5 seconds coming all the way. So I feel a good tightness right here in my inner thigh, my groin, and a little bit on the outside of my hips. So try to stay low, sink low, low, low. Good, Mindy. Good. Chris will try to sink even lower. Great job, getting low. Good, Karen. Good, Rick. Great job. Again, coming back. Got another 20 seconds on this one. Great job, Allison. Excellent job. A little bit slower there, Beth, as you do it. Yep, slow. There you go. Then stand all the way up and come all the way back. Got 10 more seconds to try to go each side one more time. Good. And you can relax. That's going under the hurdles. This one is going to be going over the hurdles. So now we got to go over the hurdles. What you're going to do with your leg, you're going to pick your leg up, come over. Pick your leg up, come over. Pick your leg up. Try to keep your leg as straight as you can here, coming up, and then coming all the way over. And then try to circle it all the way around. I know the space is a little bit crowded, but you're focusing on now going up and then over. Up and then over. We're going to do this one for a minute. So the hips should be able to flex up a little bit more from doing the knee grab. And coming up, coming over. Each time you're trying to get that hip up even higher. Coming up, and you're going to do right, Rick, and then come to the left. So we're going to go away from the body on this one. So you're going to come with the right one coming out. Yep, now take the left one and then bring the left one out. There you go. We'll get to in a minute. We'll get the one coming on the inside. Good. Lift it up even higher there, Karen. Good. Try to keep that leg fully straight because the next one in a minute you'll have your leg bent. Again, come up. Got another 30 seconds on this one. Reach it up. Circle it around. Try to reach up a little bit higher, Allison. Good. Good, Beth. Try to circle that hip out. Good, Marcy. Great job, Tammy. Another 15 seconds. Great job, Sandy. Reach up, Crystal. Good. Reach up, Landy. Perfect, Landy. Getting higher and higher. Good. Don't up. Where do you feel that at when you're doing this? Perfect. We got it. All right, and you can go ahead and relax. That's going under or over the hurdles?
Over.
That's over. Under, again, remember, wide squat position. Coming side to side. Under. And then now we're trying to bring our legs over the hurdle. This one, the next one, is called a fire hydrant. Call it fire hydrant. Essentially, I used to do it with my baseball players. Used to do speed and agility during the break when I wasn't teaching. During the summer, coach the baseball team. So this one, I would do it with them, sitting on 4 here, and then coming out and then bringing it back in. They call it a fire hydrant for a dog for a reason. Going through fire hydrant, lift your leg up. But on this one, we're going to stand up and do it because it'll help get your heart rate up a little bit higher. So you're going to stand up again. We've already done the knee grab. So now you're going to put 2 and 2 together. So here, and we're going to circle out. So we're putting those 2 together. So flex the knee up, circle it out. And you're going to externally rotate the hip. And you're going to abduct the hip away from the body. And you're going to go right, and then up. Then you're going to go left, circle it out. Again, each time, trying to get a little bit higher and really focusing on circling that hip fully as far as you can, keeping your hip square, trying to turn the whole body as you do it. Hip, shoulder square, circle it all the way, try to face forward. Good, another 45 seconds. Good job, Homer. Good, Sandy. Hip, shoulder square. Good, Karen. Getting up and over, Darlene. Where do you feel that at, Tammy? Feeling the hip, inner here. Good. Where do you feel that out, Marcy? Same thing right here. Got any little tightness out there, little pain out there? Again, reaching up, coming over. Good, Allison. Again, this one you want to keep the knee bent. So now we're not going to keep it straight. We're going to keep it flexed and then come out. Good. Another 15 seconds on this one. Good. Coming up and away. Good, Rick. Good. And you can relax. All right, now we went away from the body. We've externally rotated the hip, abducted it. Now we're going to internally rotate the hip, and then we're going to abduct it toward the body. So here, now come in. So you're going to start it out, and then bring it in. So you got to circle the hip out first, and then bring it toward the body. Stop when you're right here in front. You don't have to come all the way across your body. Stop when it's directly in front, and then straight back down. Good, Rick. Bounce. Yep, hold that. You got to slightly bend your knee to give you a little bit more bounce. It'll give you a little bit more stability. Good, Bart. Drive it up. Refill that, Amy. Flip the hips, feeling outer. Perfect. Again, reach it up. Good. And try to keep it held all the way when you bring it all the way through. Good. Bring it back down. Got another 20 seconds on this one. Bring it up, bring it out. Good. Picking it back up, bringing it back around. Good. One more each side. Good. And you relax. You should be feeling that again in front of the hips. In the outer here, when you're doing that under the hurdles, you'll feel that more in your inner thigh and your groin. All right, those are the ones to do before. So those are your good ones, mobility to do before. These last 2 here are better to be done once your muscles are warm and after training to specifically hit the outer thigh into the glute here, as well as hitting the hips for the last one. This one is called a pigeon pose. All right, this one's a little bit more difficult to get into it. If you can't get into it, I'll show you a modification you can do. This one, you're going to get all the way down onto the knee. The goal here is to try to keep your front leg here, making a 90 degree. As I get into my stretch, I can't keep it 90. You'll see that my heel starts to pull back. So that's letting me know that my outer hip here is super tight. What you're going to do on this one is lift your back leg up. So now I'm going to actively stretch this back hamstring. And what you're going to do is you're going to lean back. And then as I push forward, what it's going to do is stretch out this hip. So as I push forward, I'm going to feel a relax on this. But it's going to stretch the opposite side that's straight. And again, as I push back, I'm going to get a deeper stretch on the outer thigh. So it's almost like the one we do when you're stretching at the end. You get your piriformis and glutes here, but this is going to put you into a deeper stretch doing that one. This one's called the pigeon pose. If you can't get into that one, you can stand up exactly how you are. Maybe your knees hurt or your hips are super tight. You can stand up how you are. You know how we just did the knee grab? You're going to grab your ankle, and as you pull up, you're going to take your hip, and then push out and hold it for 3 seconds. And then bring it back down. Grab the knee up, push it out, and then push down. That's going to get you into the glute and piriformis and into the hip there. So Tammy's got it, Karen's got it. Again, if you can't keep it to 90 degrees, that's fine. If your bend of the knee comes at 45, that's fine as well. Again, each time you do the stretch, you're going to get a little bit more. So you're going to lift that back knee up, Lena. Yep, now you're going to push forward, get deeper into the stretch, and then push back. Again, make sure your back's nice and flat. Make sure you're not getting any hyperextension of the lower back. So keep your back nice and neutral. And then you're going to push back. Try to keep the back leg as straight as you can. The straighter you can keep the back leg, the more you're going to get into that back hip flexor.
You up on your back
Yes.
toe?
Yes, you're up on your back toe. If you have your back knee to the ground, now you're going to be passively stretching your hip flexor because that hip flexor can rest.
This is supposed to be a 45-degree angle, the front leg.
Ideally, if you have really good here, it'll be at 90 here. So now we have 90. I can't keep mine at 90. So mine comes here about 45, the hip comes up. Ideally, you want to keep that hip pressed to the ground as well. Marcy got really good, but she does Pilates a lot. That's why she has yoga. She got super good flexibility. Good, Karen. Did you feel that pain in that hip, Karen, when you're doing this one?
Yeah.
Again, one good thing I was telling Karen the other day, as you do any of the hip flexor, think about whatever leg is back, squeeze that glute, and what it's going to do is rather than you pushing and hyperextending the back, it's just going to help you stay exactly where you are, and all it's going to do is rotate your pelvis. So I'd say probably 95% of people have a lot of anterior pelvic tilt. I have anterior pelvic tilt. My hips are tight. My glutes are not as strong as they've been because I haven't been working out. So my hips are even tighter now. So what it does is it gives you that curve in the lower back. So if you check where my lower back is, where my shirt's at, you can see that I have a curve in my lower back. That lets you know I have anterior tilt. When you push your glute forward, then you're going to posteriorly tilt it and then get it up. And you're going to now feel a deeper stretch. Just by standing here, I can feel a good deep stretch. How many of y'all, when you do the stretch here, you don't feel much? You don't feel a lot? Because you're just standing there. You're not actively engaging. You have to squeeze that left glute and push. And now just standing here, I can feel that. Switch to the other leg on this pigeon pose. Again, you may have one that's a little bit tighter, a little bit more flexibility on one than the other. Again, you can get the same benefit there. Grab the ankle. Yep, and then push down. Good. So you're going to try to go ahead and grab the ankle there, balance, and then push down. So you're trying to get it, that same thing, getting it to that 90 degrees there. We'll go another 30 seconds on this leg. Try to bring your ankle a little bit further forward there, Allison, if you can. If you can't get as far as you comfortably can get. Again, if stretch is not going to be comfortable, you should feel a slight little discomfort. Nothing too painful, but each time as you lean back and push forward, you should feel a little bit better. The pain should decrease as you go forward and back. Great job there, Randy. Perfect. Yes. You're trying to keep that leg straight. I want you to lean your body forward. Good. Now you're going to lean back. Good. So try to lean your whole body back with it. So I'm here. Push all the way back onto the balls of your feet. And now go all the way to the toes. There you go. All right, and relax. That one's a pigeon pose. That one's a little bit more advanced to get into it. The last one we're going to do, and it's one of the ones we do during the stretching, is the same one I was just talking about with the hip flexor stretch. I'm going to show you another way you can get into it where it can get into the hip a little bit more. My hips aren't quite as tight to get into it, so I might have Whitney come over here to show you how to get into this one. This one, she's super flexible, probably the most flexible person. I took her through it, and I was like, she didn't need it because she's so flexible. This one is going to get to the quads, where the quads come into the hips, as well as going to get the hip flexor itself. So she's going to get down on one knee, and she's going to grab her back ankle, and what she's going to do here is stay exactly how she is. Again, what happens a lot of times, people are just standing there. She's going to engage her core and squeeze. She's going to squeeze her right glute and tilt her pelvis up. So now she should feel this all the way down here. Without even moving, she didn't move at all, she just engaged. Now she feels that deep pain. What happens when you have that super tightness in your hip already, when you just push yourself really far forward, we want you to drive forward, but what you can actually do is you're so tight in that capsule with the ball of socket, what you can do is take the femur, you're so tight that you don't have a lot of movement, you're just pushing the femur straight into the hips. That's why you feel that super deep pain. But when you're in this one, the femur is actually going to tilt back a little bit because the hips are pushing forward and you're rotating again post-shoulder. So here, I can stay in this position. If you can't grab your ankle, that's fine. All right, so I want everybody to get on one knee here. If you can't grab the ankle, that's fine. I can't get into mine. So here, you're going to hold it, squeeze, and then all you're going to do is squeeze which glute? Whichever side is back. So I want you to squeeze that glute, engage your core, and push and try to rotate your hip up. You feel a deep stretch